Hospitals. Take charge of your health today.
The biggest stars. 5, 4, 3, 2, 1.
Ladies and gentlemen.
Ladies and gentlemen.
Ladies and gentlemen.
The biggest names in music.
Oh, wow.
Big names, big songs, big guests, big prizes.
Well, it's a big show.
The Big Show.
Put your hands together for the one and only
Glenn, Angel, FD, and Sean.
That's what I'm talking about.
1FM 91.3. Good times, greatest hits.
Welcome to the biggest and best breakfast show in the world. It's the Big Show, and this morning it's Good Morning Doctor time. We welcome interventional cardiologist from Mount Elizabeth Hospital, Dr. Paul Chiam. Good morning, doctor.
Good morning, Glenn. I'm very happy to be on the show with you guys.
Doctor, thank you so much for joining us. Before we get into today's topic, I have a question. Interventional cardiologist. What's the difference between an interventional cardiologist and a cardiologist?
Yeah, morning, Mark. We're all cardiologists, which means we are all heart specialists. But within the heart specialty, there are some sub-specialization, and interventional cardiology is the one branch that deals with balloons and stents and doing many things in the heart, so really minimally invasively. So that's the specialty. There's another specialty which is dealing with heart rhythm problems and putting in pacemakers. We call them electrophysiologists. And then yet another group of imaging specialists dealing with complicated ultrasounds of the heart, maybe using nuclear scans to image the heart, etc.
Oh,
okay.
wow.
Okay,
So
got
it's not one shoe fits all.
Yeah, man,
No,
which
it's
means
not.
your cardiologist is also an interventional cardiologist.
But I suppose to make it
wow.
easier for the layperson, we just call all of you cardiologists.
That's
Is
right.
that
I
correct?
think it's just easier to be known as a cardiologist.
Right.
Otherwise,
Okay.
it's very confusing for people.
Okay. So today, doctor, we're speaking about specifically a hole in the heart. Now, I've heard this term quite a bit, not too much, but enough to sort of have this image in my head that someone is actually born or has a hole, a physical hole in the heart. What exactly is a hole in the heart?
So simply put, a hole in the heart means that when this person is born, there is a gap or a hole that's not completely formed between the left and right chambers of the heart. So in a normal heart, the left and right chambers are fully separated, and therefore no blood goes between these two chambers. But in some patients, due to some developmental abnormality, they're born with not a completely separated left and right chamber. So that's what the traditional hole means. But many people also have, and this is more common, where the heart chambers are separated initially by two flaps. You can imagine it's like two pieces of paper overlapping, or two doors kind of overlapping each other. In most people, after you're born, these two flaps close. But in about 15 to 20% of people, these two flaps never close.
Wow,
So
that high.
Yes. So it's essentially there is a communication between the left and right chambers of the heart.
You know what? Wait, later on the Big Show TV, Dr. Chiam will show us a model of the heart. And then, we'll explain a little bit more about the chambers and you can see it for yourself. But I just want to ask you, since we're talking about hole in the heart, what are some of the symptoms for people who have a hole in the heart?
Yes. So fortunately for many people with very small holes, they're actually benign and they may not have any symptoms throughout their lives. And most of the time we leave these holes alone. But for patients with holes that are bigger, basically what it causes is that this abnormal flow or blood flow between the two chambers of the heart, the left and the right side, this leads to a heart enlargement. That means the heart gets enlarged. And with time, the patients experience breathlessness. They may notice that their exercise tolerance gets reduced. Some may complain of palpitations. And with time, if nothing is done for these patients, they may end up with heart failure.
Wow.
So we're saying that you mentioned that people are born this way. Is it always that you're born this way, or can you develop a hole in the heart later in
No.
life?
So these are what we call congenital problems. So they're actually born with it. Not all, we don't detect all of them shortly after birth, and that's why sometimes we see them in the late teens and adulthood.
Okay. So you were saying some are benign. Are hearts only looked at when there is an issue, or do all hearts get looked at when all kids are born?
No. So we look at them if at birth we pick up some abnormal sound, we call it murmur.
Right. Okay.
But otherwise, if nothing is picked up, there's no abnormality. We don't routinely screen everybody for some heart disease because
Okay.
it is really not common, and it'd be doing lots of tests to pick up
For nothing,
small,
right?
small number of
So
people.
you're saying that some of us could have some abnormalities, but they're benign and they're not affecting our life at all.
Correct.
Okay, all right, okay.
All right. We are so privileged to have all these wonderful doctors from Mount Elizabeth Novena Hospital, Mount Elizabeth Hospital, with us every Wednesday.
Mm-hmm.
And once again, we are speaking to Dr. Paul Chiam, interventional cardiologist this morning. And because we're talking about hearts and all that, the next song that I've chosen is by Heart.
Okay.
It's called Alone, right here on 1FM 91.3. We can do the model now, actually.
Yes, we can.
should,
Yeah, let's
explain
have a
these
look, yeah.
flaps and things that you were talking about earlier.
So I don't know if you want to bring up, Hailey Bieber.
Hailey Bieber, yes.
So she had this flap that in the news report that said she had a hole. Technically, it's not. It's a gap, not a real hole, as in so the two flaps never fuse.
So where is it in the model?
So it will be on the two upper chambers. I don't know if you can see.
Yes, you can see. Yes,
we can.
The
Yes.
two upper chambers, and this hole allows blood to sometimes go from the right to the left side, which is not normal.
Oh, right.
So
okay.
in some patients, all the blood from the right side of the heart, it goes to they go onto the lungs, and if there's any clot, the lungs kind of act as a filter to trap them.
Right.
But if there's an abnormal communication between these two chambers, it can go from the left to the right, from the right to the left, and then from the left it goes to the brain, and that's how she ended up with a stroke. So we do see increasingly frequently recognized young people with strokes. They don't have diabetes, they don't have high blood pressure, and they end up with a stroke. And someone like her, and it's due to this flap that's not closed, and we can treat them by closing this flap with a minimally invasive technique.
So you're saying it's increasing now?
It's not increasing, it's just that we increasingly recognize it.
Okay. So you
So
know
what to look for.
Yes.
Yeah.
But why didn't she have this problem, in her
she was
younger
younger.
years
Yes.
and only now?
Correct. So the question is, if this flap was all the time there, why not at 10 years old?
Yeah,
and all that?
exactly.
I think the other reason is that you need a blood clot. So you need two reasons, right? One, the flap to be there. One, you need some clot to be floating around in the sort of venous blood system or the veins. And unfortunately, as we grow older, the clots tend to form more as we get older. And the veins are where the blood is flowing the slowest. And as long as the blood is flowing slowly, it tends to form clots. And we don't see that in young children. These are all problems as we grow older in young adulthood, maybe 40s, 50s, and that's where we see them.
Then you
Wow.
feel it.
So are there any other issues that can arise from a hole in the heart? There is the one issue of getting a stroke. Well, are there other issues?
Yes. So again, with this flap, which is relatively common, I've seen divers with they call it the diving illness or decompression illness.
Yeah.
Yes, and so again, that's this flap kind of predisposed people like them to end up with the decompression illness. So we've actually closed a couple of these patients who want to go back to diving. So one choice they have is never dive again.
All right.
Yeah.
But if they want to, and some really want to, we have to close them to reduce the risk of decompression illness because it can be really fatal event.
Yeah, it can be.
Yeah.
So any other sports besides diving that someone who's living with a hole in the heart can't do? Anything that exerts?
Yeah, so
The
if it's
pumping, I
a real
suppose.
hole in the heart, I think we kind of advise them not to go and have really strenuous exercise. I think light to moderate intensity exercise are okay.
So
And
let
they
me-
physically feel it, do they?
Some of them may feel a bit, so they may not have as good an exercise tolerance as a normal person
Right.
would
Okay.
have.
So
I
is
think
it-
golf will be good.
I was about to say something like golf is probably okay, but other competitive exercises are basically ruled out.
Yes, correct.
So they can't pump their heart too fast or too
No, so
strong,
there
is
is going to be always an overload. The way the blood flows, one chamber of the heart gets a bit of overload. Yeah. And if you read that Manhunt story, which we also wrote in, that's what happened to him. I think Straits Times featured him a few months ago in March.
Yeah.
Manhunt winner with a hole in the heart. When he was in primary school, he was barred from doing all the activities, and even
Because
though
of
he
that.
wanted to, and he just looked at people running, and he felt very upset about it.
And then he got
yeah,
it
yeah.
fixed.
Yes, at 10 years old, open surgery with a big scar on the chest.
So speaking,
Whoa.
speaking of which, that brings us on to our next question about procedures that are available here in Singapore, and is open heart surgery needed for it, which is what this
Yes.
Manhunt contestant had, right?
Yes,
Open
correct.
heart surgery.
Yes. So, open heart surgery is the most established way, and it's been done like 40, 50 years. But in the last, I think, 20 years, or maybe, the minimally invasive techniques where we can close this hole using a specially designed clamshell device, that's become increasingly available and performed. Saying that not all patients are suitable for the device closure. We actually have to do a kind of a specialized ultrasound to make sure that the hole is a certain size and there's some what we call margins of tissue around it for us to grasp to fix the device. So
Okay.
it can be done, but not every patient is suitable. So some still have to go back to the conventional open surgery.
Wow.
There's so many things that can happen to your heart, right? I mean, today we're talking about the valves and,
Yeah,
open and closed and stuff like that. And of course, we haven't even spoken about like arteries.
Yeah,
and-
exactly, exactly.
Right? So it's so scary. It's so complicated, no?
We have a question on our Facebook page, which is interesting. I don't know what it is, but Anthony is asking, is SVT a cardio issue and is it life-threatening?
So the SVT stands for supraventricular tachycardia, and that is a condition where the heart beats too fast. So it is an electrical problem, and in some patients they're born with a little bit of a short circuit inside the heart. So normally the heart pumps when the top chamber fires a signal and goes down, so it's always coordinated. So this usually causes the patients to have, their heart beats very fast. They maybe feel dizzy, breathless, but usually SVT is not fatal.
Okay.
It's more annoyance, So it can be treated with what we call a technique called ablation, using a tube to go into the heart to sort of burn off that extra electrical connection.
Wow. Okay.
I've had friends, right, who have never slept very well at night. And they've actually told me that while they're sleeping and they're having like an unrestful sleep, sometimes they're having like a bad dream or whatever, they feel like their heart is beating really fast. Is that something that's normal?
So it could be that they are having a dream, or they are anxious or stressed, and that's the case, then that's a normal fast, because the heart responds to something.
I see.
Watching a horror movie, angry.
Yeah.
But sometimes it could be something like SVT, where it is due to a short circuit and there's a sort of a current running around at high speed.
I see. So it's nothing. It's like nothing.
Yes.
Nothing should be making your heart beat fast, but all of a sudden it starts
Yes.
to beat fast.
Correct.
Wow.
Okay.
When we talk about these things like SVT and holes in the heart and things like that, we are talking about open heart surgery.
No. So like I mentioned, for
Wait, hold
holes
on,
in the-
doctor. I tell you what. Why don't you
I'll
ask
ask
doctor
that.
that question again?
Okay.
We're going back on the
Okay.
radio.
All right,
All
good.
right. Here we go.
Stand by.
What a great track. Hall & Oates, Private Eyes, right here on 1FM 91.3. Welcome to Good Morning Doctor. Our doctor for this morning is an interventional cardiologist from Mount Elizabeth Hospital. He is Dr. Paul Chiam. Once again, thank you so much for joining us, doctor.
Thank you, Glenn.
So, doctor, we've been talking about SVT and holes in the heart. When you operate on these people, we are talking open heart surgery, where literally you open the chest cavity.
Not really. So for holes in the heart, the traditional treatment option was open heart surgery, and that's been established. Still a good option for the last 40, 50 years. But increasingly, we can close some of these holes with a minimally invasive technique, where we use a specially designed, like a clamshell device, to close the hole. So this can be done through a small incision in the groin, maybe a half a centimeter incision, and the patient stays one night and goes home the next day.
Oh, wow.
And,
Wow.
there's no cut on the chest. And the SVT that someone brought up is actually different. It's a sort of an electrical problem in the heart, which usually can respond to medications, but if not, we can go in with some, again, with catheters or rubber tubes to kind of burn off the short circuit that's causing this electrical rhythm problem.
So these clamshells and things, they're put in the same way a stent would be. You because I've had a stent and they went in from the groin area.
Yes, so the stent uses the artery in the groin.
Yeah.
For these holes in the heart, we use the veins in the groin. but essentially quite similar.
Ooh.
Okay.
Wow.
I mean, is that still the case? Because I've had like a few friends who have had stents put into them, and they say it's from their wrist now.
Correct. So for the heart artery stenting or angioplasty as we know it, nowadays we use the wrist. The artery is smaller, but it's safer because it's less bleeding. But for closing holes in the heart or other minimally invasive techniques for the valves, now valves are sort of doors that allow blood to go in one direction of the heart. We still have to use the artery in the leg or the vein in the leg because these are bigger.
Oh, right. Okay. Yeah, that's incredible. So you've gone from like open heart surgery to a small incision that obviously won't be able to be seen by anyone else but the patient overnight. And that's it. The patient can walk out of the hospital the next day.
Yes, I think that's where these minimally invasive techniques are so attractive because the
Scarring.
is almost non-existent,
Yeah.
and they go home in 1 or 2 days, after the procedure.
That's incredible.
Amazing,
That's
yeah.
incredible.
That's incredible. So it's basically the same as getting a stent.
Yes, almost you could say that.
Yeah,
It's
1
a
or 2 days.
stent-like procedure nowadays.
Yeah.
You know, doctor, when we speak to medical experts, they always tell us like after a certain age, for example, like guys should check their prostate when they reach a certain age, or they should check this or check that. For the heart, I mean, I think it's one of the most important organs, right? Most vital organs that we have in our bodies. Do people get their hearts checked often enough?
I guess maybe not as often as they should. I think a lot of people do screening, which is great, like for screening for high blood pressure, diabetes, cholesterol, which is great. I think these are the things that really make a difference to the patient in terms of reducing, heart attacks or cardiovascular mortality or problems. But sometimes we need to go a bit more than that, especially if you have multiple risk factors or you have a strong family history of heart disease. And then I think more screening needs to be done apart from just these blood tests.
How often should one screen?
So I think for men, if you're at risk, maybe you start around 45, 50 age, the age range. And normally we can screen them with a simple treadmill first. And depending on what we find, then maybe they need a bit more. And then for females, usually we say about 10 years later than the men. They're protected initially, before menopause, but after that they catch up in terms of this heart disease.
Okay.
And how often should this be? Sorry, Glenn.
No,
So if the initial screen is normal, then maybe every few years, 3 to 5 years, and I don't think there's any benefit screening more often than that. The main benefit still comes from making sure the patient doesn't have high blood pressure, the cholesterol is controlled, the sugar's okay, and don't smoke.
Right.
Okay.
The treadmill test.
Yeah.
Right. I'm thinking about the treadmill test, and I've seen like older people put on the treadmill as well. So how is it? How do you gauge this, doctor? As in, like someone like me, let's say, if I go to a cardiologist and he puts me on the treadmill, I'll run for I don't know how long. How long do you usually put a person on the treadmill for?
So that depends on what's his exercise tolerance.
Okay.
We try to go to the maximum or near maximum possible for that patient.
I see.
Okay.
So I'm thinking if an old person goes on the treadmill, the person might get a heart attack. If you ask the person to run.
And you're not making all
It's
of
not
them
easy,
run,
right?
right? Some of them are just walking, or
Correct.
right?
So the treadmill follows what we call a Bruce protocol, which
Okay.
means initially it starts slow and then after 3 minutes it goes a bit faster, the incline
Right.
goes up. So it really depends on the patient,
Right.
how much he can do, and we are actually seeing what is the heart rate that's reached. We have a target in mind. So as long as they reach a certain target, we could say that this treadmill has some use in interpreting whether there's any heart problems. But if he can reach the maximum predicted, that's the best, because that will be the
Okay.
maximum exercise that he can do.
I see.
Okay,
Because it
okay.
can be quite intimidating. Some people will go on the treadmill, their heart is beating fast already because they're nervous, right?
It almost looks like a cartoon gone wrong.
Okay, we'll continue to talk to Dr. Chiam on the Big Show TV. In the meantime, here's Nickelback on 1FM 91.3. Good morning, Singapore.
Never made it as a wise man. I couldn't cut it as a poor man stealing.
What the optimal heart rate is for regular people, whether you're resting or you're exercising. I've read online 220 minus your age is for the top end, but I want to hear from an expert.
Yes. So that's the 220 minus age is sort of the predicted maximum that this person could reach. So for example, if you're 50, then your predicted maximum heart rate when exercising should be about 170. Which means that if you exercise to 170 heart rate, you probably couldn't sustain it for very long unless you're a very highly trained endurance athlete.
Okay.
So it's a point where the body fatigues.
Is that
Right,
like 80%
okay.
of your heart rate or
Oh, no,
more
no,
already?
no.
It's
So
max.
that's 100% of the predicted maximum already.
So you're not recommended to go beyond that.
You probably can't go beyond anyway.
Yeah.
Right,
Because the
okay.
body fatigues.
And it varies between different sort of tolerances, right? I mean,
Yes.
if you're at 170 but you're unfit, then you're in trouble almost.
Yeah, or they may not even reach because they cannot tolerate that exercise.
Right.
Yeah.
Okay.
But
got
that
it.
would be, that calculation couldn't work for me, right? Because I've got a stent.
Um,
So how do I then calculate it?
so if, for example, if one is 60, for example,
Yeah.
and it's 220
66. 66.
Okay.
Going to be
66.
66 next Friday, doctor.
next Thursday.
Next
Yeah.
Thursday.
For ease, you put 60.
Okay.
So
So make you.
I'm comfortable
He
with
just made
66.
you
It's
younger.
okay.
you look 60 anyway.
Oh, thank you, thank you,
Wow,
thank
you're
you,
so
thank you.
kind. I always thought he looks 80.
So how do I calculate it then?
So it's 220 minus 60, which is about 160, right? So that's the theoretical maximum that you could reach. But then we would say that if you could reach 85% of 160, that's quite a high intensity exercise for you already.
Right.
Okay,
Okay.
So
okay.
anything more than 85% of that number would be a high intensity exercise.
Okay.
Okay.
Yeah.
Okay. Now, speaking of age and all that, how common is this issue in Singapore? I mean, we have an aging population, not necessarily people getting old and frail and all that. People are actually living longer.
Correct.
How common is it for them to sort of develop heart valve diseases?
Yeah. So as we age, the fact is that the heart valve diseases are going to get more and more common. The reason being that most of the heart valve disease, the reason is because there's wear and tear. Just like your knee or the shoulder, if you run a lot, it wears out. So is the heart valve. Don't forget, as we speak, the heart is pumping all the time as we, and you're sleeping. So the valve is opening and closing and opening and closing. So this actually causes wear and tear. And with time, the valve may become narrowed or severely leaky. And when
Okay.
that happens, the patient starts to have symptoms.
Do your valves narrow as you age as well?
Yes. So the commonest valve abnormality is something called aortic stenosis. So the aortic valve is, you can see this valve that leads out of the heart. So when the left heart chamber pumps, everything must go out through this aortic valve. So and with any biological tissue, it can undergo wear and tear. And the commonest thing that we see is the valve narrowing or aortic valve stenosis. And the valve becomes so narrow that sometimes it can barely open.
Is it narrowing naturally, or is it narrowing because it's getting sort of clogged?
Yeah,
from
so the
food
wear and
that
tear
you eat?
process includes thickening of the leaflets, calcium being deposited on the leaflets, just like the heart arteries. In
Right.
fact, we used to think that the pathology or the disease process affecting heart arteries, atherosclerosis, is what is happening to the valve. It's similar but not entirely the same. So you can imagine that there's cholesterol, there is calcium, and the valve becomes thickened and hardened. So it can't normally opens and close and opens and close, but now it cannot even open.
Oh.
Yep.
Oh.
So the orifice that allows the blood to come out becomes very, very narrow, and the strain on the heart is very great.
Right.
So, doctor, am I right to say, I mean, okay, we in order to take care of our heart, our diet is key.
Yes. So I think the basis is still a lifestyle thing, exercise and diet. So exercise is, as we know, it has many benefits: blood pressure, blood sugar, cholesterol, and of course diet. Everything in moderation. I tell my patients, because sometimes it's really hard to say what you should eat, what you should not eat, and it's difficult just to live eating bland chicken, breast every day, and it's all
delicious.
vegetables.
It's near impossible, let me
Yeah.
tell you.
I actually went out there to look for, because we take vitamin C, to
Yeah.
strengthen our immune system. We take omega-3 for various things. I believe omega-3 is also good for the heart. We can have it in natural foods naturally. I mean, fish and stuff like that. But something I've been taking since the age of like 40, because I've always been quite active, and someone recommended it to me, is CoQ10. How important is CoQ10, and does it really protect the heart, especially for people who are physically active?
So CoQ10 is probably in a category of supplement. We don't really recommend it for the heart itself.
Okay.
In many patients who are using this medication called a statin, which is a medication to lower cholesterol.
Yeah.
Now some patients develop muscle aches and all this from the statin, And CoQ10 has been shown to reduce this phenomenon of muscle aches and some of the side effects associated with statins.
I see.
So that's where the main utility of this supplement is. On its own, I do not think that it actually improves the heart health or lowers cholesterol or nothing like that.
I see.
So you shouldn't be
Man,
taking
all
it.
these years I've been taking it, Yeah, especially before like physical activity. If I'm going on a long run or whatever, I'll just take one.
Yes.
You know,
So
I
you
was
shouldn't
told-
be because you have no issues, right?
And it's so
Well, I guess no
expensive.
harm. No harm though.
Huh?
There's
No harm,
Yes,
okay.
But I'm not sure there's really a lot of benefit.
Benefit,
Yeah.
right? No benefit. There you go. Okay.
We're getting a lot of questions on our Facebook page. Another one from Prashant.
1 minute.
Could you tell us more about Disepnia and the bubble study?
Okay. So this bubble study is coming out from the flap that we mentioned. Basically, the scientific term is called PFO, patent foramen ovale, PFO. And to demonstrate that there is a flap that allows blood to cross from the right to the left side, which is abnormal, we do a bubble study, meaning that we put a little tube in the patient's vein. We use salt water and agitate it to make it foamy and bubbly, and then we inject into the veins. So normally these bubbles will go to the right side of the heart. It goes to the lungs, and nothing else is seen. It's finished. In these patients, like Haley Bieber, you will see that these bubbles end up from the right side of the heart, and you see them suddenly in the left side of the heart, which is abnormal. Because
Sorry, we go back on air and
Okay.
you can
I'll
carry
ask
on
the
this
question
question
again.
Okay.
In 3, 2.
Rick Astley, together forever, right here on The Big Show and The Big Show TV. Our guest for this morning is Dr. Paul Chiam, interventional cardiologist from Mount Elizabeth Hospital.
Okay, Doctor, Prashant's question. Could you tell us more about Disepnia? I think that's how you pronounce it.
dyspnea, Dyspnoe.
Is that how you pronounce it? I have
dyspnea.
dyspnea.
Dyspnea. Okay.
I saw the P, so
What do you say, FD?
Disepnia.
Dissep-
Because I saw the P. It's
Dyspnea.
dyspnea.
Dyspnea, okay.
And something called the bubble study.
Yeah. So the dyspnea just is a medical term for breathlessness.
Oh, right. Okay.
Sexy sounding term, but
yeah,
it just means breathlessness. So the bubble study is a test we use to look for patients with that flap in the heart that I mentioned, the two flaps that never close in the upper chamber. So if you remember the story about Haley Bieber having that mini stroke, that's what she had. So to demonstrate this flap is there, we have to do a bubble study, meaning that we put a small little tube in the patient's vein, and we use salt solution, make it very foamy and bubbly. We then inject this foam salt water into the vein. So normally we can see a lot of bubbles in the right side of the heart. And in a normal person, this is pumped to the lungs, and after that the lungs filter them out and we see nothing else. In patients with this flap, which is called a patent foramen ovale, or PFO for short, these bubbles cross from the right side of the heart abnormally to the left side of the heart. And we will see on this ultrasound that there's now bubbles floating in the left side of the heart. And if you can imagine this, the left side of the heart pumps all the blood to the brain. If these were small clots, then these clots will end up in the brain and cause a stroke. So that's what the bubble study is to prove that the patient has a flap in the heart, or PFO.
So a person who's continuously breathless, should they go for a bubble study?
No. So it's slightly different. Most of these patients with PFO don't really experience breathlessness. They end up with a young stroke, or they may have what we call a diving illness, like decompression illness, which we hear about in divers.
Yeah.
The true hole, which can also cause stroke, those are the patients with who end up being breathless and have what's called dyspnea.
Okay.
Wow.
Dr. Chiam, actually, I want to ask you this question. Right? I'm sure a lot of our 1FM listeners are also thinking the same thing. I usually can read their minds, you see. Okay. So, what's your diet like?
Me?
Hey!
Yeah, no,
we'll
that's
eat what
true.
the doctor is
That
eating.
is true. You're a cardiologist.
okay,
You would.
alright.
Do you have the best diet that you would recommend to everyone else?
No, not really.
Balanced, a bit balanced.
I tell my patients everything in moderation.
Yeah.
So I eat most of the hawker foods that's
Okay.
unhealthy actually, but I don't think I will do that very often. And I think the key is to moderate them. Even like char kway teow, I have them once in a few weeks. I think it's okay, and it really depends on your own current levels right now. If your blood pressure is good, your blood sugars are okay, and if you're lucky enough to have a naturally low cholesterol, I think some of these won't make a big difference to you. But if you're one person with a borderline pressure and borderline cholesterol, then trying to cut this down to the minimum may make a difference to that person.
Question: what supplements do you take?
Oh, I don't take any.
Oh, you don't take
supplements.
any at all?
I'm too lazy to take them in the
Too
morning.
late. He's the wrong person to be asking then.
My goodness, I take supplements in the morning, supplements at night.
I know, yeah.
Why?
But I'd love to ask you about aspirin, though.
Yes.
For people that don't naturally have issues, like thickened arteries or whatever it is it still safe to be taking, say, half an aspirin a day to sort of keep that away?
Yeah, so the evidence or the scientific evidence now tells us that for patients like that without established heart disease or blockages elsewhere, there is really no benefit in taking aspirin.
Oh, really?
Oh.
Okay, no benefit. Okay.
So the what happens that if you take aspirin, you do reduce the risk of heart attacks, for example, let's say in a group of patients. But unfortunately, you will increase the risk of bleeding in some of them, and that includes the risk of major bleeding, which can result in very severe consequences. So then the benefit and the risk cancel themselves out.
Wow.
So
okay.
yeah.
When you say bleeding, you're talking internal bleeding.
Yes, correct. So I'm not talking about the bruising that we see on the skin, which many of my patients tell me. Those are very, very minor. We don't even bother. But internal bleeding could be bleeding the gut, bleeding in the brain, causing a stroke.
Wow.
So when you have benefit and then there's a risk, we always weigh them. And in most of the big studies, for normal people, if you take aspirin, it seems like the benefits cancel out the risk and
There's no point.
use. Yeah.
Right. Okay. Got
Okay.
it. Okay.
Man, I was about to take an aspirin before working out as well. Okay. Luckily, the doctor is here today.
Yeah.
Okay, we'll continue to talk to Dr. Chiam on the Big Show TV. In the meantime, here's Kim Wilde. You keep me hanging on 1FM 91.3. So, Doctor, I mean, what is your wish for Singaporeans? If there's one wish, that they would be mindful to do or not to do, or whatever, what would it be?
Yeah, and I think that wish would be for people to lead a more healthy lifestyle, get some exercise, and really from the viewpoint of a cardiologist, it could be any exercise. It doesn't have to be running, it can be anything. Even just going to the gym, lifting some weights and, doing squats at home. Anything is good.
Just
But
moving,
doctor, don't you
yeah.
think some people are working out too hard these days? It's getting a little bit more. It's getting
Yeah.
quite extreme.
Yeah.
The different, the fad workouts,
Yes.
that's coming about.
So we all hear about the spinning classes.
The
that
raptor.
There.
Yeah.
This is a spin
He's
instructor
a spin
right here.
instructor. So according to Sean,
Yeah.
none of the spin instructors have suffered this rhabdo
Right.
disease that a lot of girls and guys have come down with. What is it and why is it happening?
I think probably those people who end up with this, they're probably not so conditioned in the first place physically for these classes, and sometimes they don't know when to stop if they feel pain.
All right.
Yeah.
Okay.
Push
They,
on
they
because
think the pain is like good for
Yes.
them. Like,
Part of that.
I'm pushing myself, that kind of
So
thing.
at some point, you really have to listen to the body. The pain is there for a reason.
Yeah.
Just as if you get a bad sprain, the body is telling you not to put weight on that joint, and if you continue, then it's going to get worse.
Because see, it's unlike running, you see. Running, let's say I've never done a marathon before, 42.195 kilometers. And then all of a sudden at this age of 52,
You decide to go for it.
like an idiot, I decide to go for a run. I can stop anytime, you see. But when you're on the spin bike, you'll still keep on going.
Because
you
you're
see. And
motivated by everybody
Yes.
else that's
Yeah.
there as well.
Peer
The
pressure.
music is
peer
pumping.
pressure. If
Peer
you run
pressure.
in a group as well, same.
Same,
You
yeah.
don't
Yeah.
stop.
Yes.
Yeah. Doctor, pardon my ignorance. Earlier you were talking about bruising. I mean, what? Can you explain more about that? What
Oh
happens?
no! So when people take aspirin, because aspirin is a weak blood thinner,
Thinner, yeah.
so the blood doesn't clot as easily as as a normal person. So sometimes with very minor trauma, that means they may knock their hand against the table, which they may not even remember.
Yeah.
The next thing they tell me is, I have a big bruise on the
Yeah.
on the hand, and these are minor because they are just bleeding under the skin. And it's more common in the elderly because as we age, the skin becomes a bit thinner, unfortunately. And with aspirin, makes them more likely to bruise easily.
Right,
But these
okay.
are different from the internal bleeding, which we worry about.
Got it.
Bruising,
Okay.
also
bruising.
known as artery.
But you know what? I bruise super easily. I wake up the next day with bruises I don't even know about. Should I be worried? No, really, I do. I bruise very, very easily.
Not really.
No.
I think it's just again is a person to person thing.
Okay.
Some
okay.
people just have very superficial veins, which tends to break a bit more easily.
Okay, so nothing to worry about, right?
No,
Okay,
I
good.
wouldn't worry about it.
Okay, great.
So I've heard about this, doctor, and KM Yo has brought it up on our Facebook. Can you talk about white coat hypertension?
Yeah. So
Got 20 seconds.
in many patients, when they come to the clinic, the pressure is very high. When they go home, it's normal. So they belong to a white coat syndrome. But we do know that people with white coat hypertension are more prone to getting high blood pressure later on in life.
See. Okay, ask that question again.
I
It's very
will, I
interesting.
will.
Okay, here we go.
Spend a
Okay.
bit more on
Yep.
air. A little
Yep,
bit
there we go.
standby in 4, 3.
Kim Wilde, they keep me hanging on right here on The Big Show and The Big Show TV. Our guest for this morning is Dr. Paul Chiam because it is a Wednesday. So it's Good Morning Doctor Day. Dr. Chiam is an interventional cardiologist from Mount Elizabeth Hospital.
Okay, Dr. Chiam, I know what this is because I get it very slightly when I go to see a doctor. And I think I get it only because, oh my God, what's he going to find out now? White coat hypertension. Can you explain it?
Yeah, so this syndrome happens when patients, when they come to the office, the pressures are very, very high, the blood pressures. And when they're at home, the pressures are kind of normal, totally normal or something. And they always tell me, oh, no, pressure is home, it's 120, in the clinic it's 160, 180. It could be true. And sometimes to prove that, we have to do what we call a 24-hour blood pressure monitor, where we fix on a portable monitor and they go home and we record over 24 hours to prove that their recordings are truly normal at home. Now, the good thing is that they are not hypertensive, but we do know from many studies that patients with white coat hypertension, they are actually more likely to develop true hypertension sometime in the future, because I think the way the body responds tends to be a bit exaggerated.
Oh, so they
So
get
they're
more
not-
anxious.
Yes, and
More
everything goes
exaggerated.
up. The vascular, the blood vessel tone goes up. The pressure goes up. So it is not a benign thing as nowadays. So we do know that it's not as benign as we thought it to be.
Yeah.
Okay.
So just
Okay.
be careful. So, for people who are like that, just monitor yourself a little bit more, because high blood pressure is a silent killer.
Yeah.
Now,
Right.
you look at people today, they take their blood pressures at home because we all wear these watches that take your blood pressure and your heart rate and things like that. Most of the time, how accurate are these things?
I'm not entirely sure. The heart rate monitor sometimes goes a bit off, especially because there's a lot of interference and false readings. Sometimes patients have what we call extra beats, and because of the way the watches or the algorithm calculates the extra beats, suddenly they will see the heart rate shooting up to 150 and it comes down again. It's all because of the algorithm in the watch. It's not that their heart rate is actually 150 over 1 minute, which
Right.
should have been. But I guess it's a good way to pick up some things, but it's not entirely accurate. I
So
would
just
say.
use it as a guide,
I don't
not
like-
as the blind
Use it.
truth.
Use it as a watch.
These devices are sometimes just mess you up.
Yeah, they
that's
do.
what-
Like
that's
now
what
when
I
I'm
mean.
running on my treadmill, I'm constantly looking at my watch, just okay,
Yeah.
Yeah.
make sure
Yeah.
I don't go over, because
Yeah.
if I go over, I think my heart will stop while I'm running on the treadmill. And it affects you, It's
right.
like, anyways, okay. Do we have another question for Dr. Chow?
Yes, we do. Ken, what do you recommend for a mid-30s recreational athlete with a high heart rate during moderate to light exercise? Should I see a cardiologist and get on that treadmill?
Probably not if there's no other symptoms. The high heart rate during light to moderate exercise could be also a reflection of the fitness level. So saying what it means that if the more fit you are, the more likely you will have a lower heart rate at the baseline, that means before exercise, and the longer it takes for the heart rate to increase. So if you're less fit, it means that at rest your heart rate is already on the higher end, and once you exercise, it goes up very fast because the heart has to try to pump blood to supply all the organs, and if you're not fit, the heart has to work a lot harder, and that means it has to pump faster.
Doctor, I just want to ask you something. How important is the way we breathe for our heart health?
Probably not. Nothing really significant. I don't think there's any correlation between how you breathe, even during exercise. Of course, once you get a very high intense level, or the heart rate is going at a very high heart rate, the breathing gets very, very
Short.
short.
Yeah.
But that's a normal phenomenon because you are trying to get as much oxygen to the tissues as possible.
So is the short breath better, or is taking a deep breath, better?
Yeah, I don't think there's a difference. Not for the heart, at least. But I think for most athletes, they'll tell you you need to control the breathing. It's deep, and if you breathe too short, the work on the chest muscles increase. You may tire yourself out because the chest actually. Don't forget that the chest muscles are working very hard when you exercise.
Okay.
This is another thing that people mess other people up with.
Breathing.
The whole you need to breathe deeper. You need to breathe
longer.
You can't breathe, that deep.
Yeah.
You need to breathe through your nose. You need to breathe through your mouth.
Yeah.
It's like breathe through your mouth, breathe through your nose, and breathe out through your mouth. It's like, oh my goodness.
As long as you're breathing, right?
It's like if you're running long distance, right? At some point, you're just going to be breathing through your mouth.
You're going to be opening up your
because
mouth.
you want to take in more oxygen,
Or
right?
at least feel like you're taking in more oxygen. I don't know. I don't know how it actually works.
I need to take in more oxygen the more I run, you see.
Yeah.
There's one time I was trying because everyone is saying, Glenn, breathe through your nose and breathe out through your mouth. Oh my goodness.
I don't think that works for everybody.
Yeah, exactly.
It doesn't work for anyone.
Doctor, I've got two final questions for you that I think are really important. One is from Albert Tay. A child aged 12 has a heart murmur since birth. The child seems very healthy. What should I do?
So I think the simplest way to investigate this murmur, which means an abnormal sound in the heart, is to get an ultrasound scan. We call it an echocardiogram. It is simple, it's totally painless and safe. It's the same ultrasound that we use to scan the babies in the mother's tummy.
Right.
So that can be done easily. It takes about 20 minutes, half an hour, and we have all the answers after that.
Okay.
Second question concerns me. What was it, 9 years ago?
Okay.
I had my stent put in.
Yes.
You hear all kinds of people who put expiration dates on a stent.
Oh.
Is there such a thing?
There is no such thing.
Oh.
So the stent once we put the stent in, basically what happens is that the artery wall grows over it. So you can imagine the layer of very fine cells that grows over the stent. So to cover the stent, the metal becomes part of the artery wall.
Okay.
Now, in most patients, I would say 90% of people, that hopefully is a permanent solution. And if you control your diet, your cholesterol, we can keep it that way for a very, very, very long time. Okay. In less than 10% of patients, some form of re-narrowing may occur. It's like a bit like a scar tissue, just like you get a keloid after a surgery, a surgical scar, or a bad BCG scar. So same thing happens in the artery. The tissue may grow over the stent and it cannot stop growing.
Right.
So the re-narrowing occurs from scar tissue inside the artery.
Then what do you do?
So in patients like that, we can go in and re-balloon the artery, and sometimes we use special balloons with drug coating to reduce this phenomenon of scarring, or sometimes we have to put another stent in.
Right, okay. And that's when it expires as such.
Yes, but it's not really
expiry date. Okay.
So people with stents, once again, you got to live a healthier lifestyle.
That's correct.
Watch what you eat.
And this second stent is put in the same way the first one was.
Correct.
Through
Exactly.
the wrist.
Yes.
And the first one's taken out?
No, it's already permanently part of the artery wall.
Right.
Yeah.
Okay.
I tell you, doctor, because of this guy, 9 years ago, gave me a shock, right, when he had his heart problem. After that, right, I stopped eating hawker food.
Oh, wow.
I was so scared.
Yeah.
I quit smoking.
Which is good.
That's good.
That's good.
Till now, it's been 2 years since I had my last laksa, and 2 years since I had char kway teow. Because this guy told me that 3 months before he had his heart attack, his arteries were
Apparently
totally
they were
clear.
clear.
I'm thinking, if I eat my laksa now, it's going to clog up my
3 years
arteries.
later.
Now, is that true or not? He said his doctor
Because
said
according to my
3 months.
3 months, I developed the blockage, which
How
seems
is
to
that?
me.
How is that?
Everybody tells me not possible.
So it could have been a very, what we call minor blockage. So that you can think of a blockage like a volcano. It doesn't matter whether the volcano is very big or is a small volcano. If it bursts or ruptures, we call it, that causes the heart attack. So, but the things like smoking and increases the risk of that rupture. But if you're on cholesterol medications, your cholesterol level are low. It's been the cholesterol medication in particular has been shown to stabilize this volcano. So imagine putting a layer of blanket to cover the volcano up, and therefore reduce the risk of heart attack.
Okay.
But your blockage was quite bad. What was it? How many percent?
90 something.
90%. Cannot be
Over 3
in
months?
3
I mean, how
months.
quickly
Over
did
3
it?
months.
So one possibility was that it could have been a 20 to 30% narrowing. for example.
Already.
Yeah, and sometimes the volcano ruptures. It doesn't cause a heart attack, but it suddenly, because of the rupture, it enlarges and becomes 60, 70 at one go.
There you
So
go.
it could have been that
It
way.
could have been that.
way.
I just want to find out: is there? I'm on heart medication. I've got the thinners. I've got the cholesterol. I've got all these various things. Are there any supplements I shouldn't be taking?
Not really. I don't think most supplements are safe. Just that I don't know how much benefit there will be on top of the medications you're already on. But usually there shouldn't be any harm taking these supplements.
You're asking about Viagra or what?
No.
Oh, no, just checking.
Thank goodness, don't need that.
Look at him.
That's awesome.
On that note,
On that note, thank you so much, Doctor, for
Thank
joining
you.
us today.
Thank you.
We've been speaking to Dr. Paul Chiam, interventional cardiologist at Mount Elizabeth Hospital.
Good Morning Doctor was made possible with Mount Elizabeth Hospitals.
Take charge.
That
was awesome.
Doctor, well done.
Thank you.
good job.
Hope you enjoyed
We're
yourself.
still
okay.
live, so
All
don't,
right, all right.
don't swear.
That was really good.
Don't say you change your mind or what.
About everything that he said. I was lying.
There is expiry date. Oh.
But is there anything that we should be taking? Like in terms of keeping better heart health, types of foods and stuff like that.
So
Anything
it's-
that you would highly recommend?
Yeah, so I think the simple thing is more like vegetables, fruits, fish, and less of red meat. Yeah. So again, not that we cannot take red meat, but less, and try to cut out the fatty portions.
Yeah.
So red meat, you cut out the fat, take the lean cuts.
Tenderloin.
None of that. What were you talking about on the satay stick?
Oh, no, I had a
What is
salmon
it?
belly
Tuna
skewer.
Belly, but that's
Actually, it's
fatty.
okay lah, but they
Yeah.
put
Fish is
char-siu
okay,
sauce
Char-siu-
over
I
the
see.
Sauce.
Yeah.
But the belly is, the fat is
The
still
f-
fat, right?
No, the
it's
fish-
different.
Yeah, the fish oil is different. So the
Okay.
fatty fish actually is good for us.
Yeah.
Okay,
Omega-3,
the omega-3.
It's interesting. You were talking about the cholesterol medication and exercising and stuff. Could that be why, if I walk at pace, my calf muscles tend to cramp?
It's a salt. thing,
No,
right?
I think
No.
it's because
That's what
of
they say.
that particular. So brisk walking tends to burn up the calves a lot more than running. Whereas I think running tends to use more the thigh
The
muscles.
thigh muscles.
Yeah.
So it could be
So-
it's just what I'm doing.
Yes,
It's
correct.
not the medication.
It's like you weren't telling
So
him, lah,
go
doctor.
run.
Play golf with me. Yeah, golf will be perfect for
I
him, right?
cannot-
as long
Don't you
as
think?
he's
I can't
moving,
play
right?
golf. You chase a little white ball to put it in a hole. I
Never
cannot.
mind.
And the weather's too hot.
Yeah.
So
No,
hot.
white boy.
I can't grip. I went for some lessons once.
Oh, he
Couldn't-
plays golf. There you
No,
go.
I
you
gave
don't.
up because
Oh, you gave up.
it was so hot that I couldn't grip the thing. It was all
Gloves. That's it. He's
One
got,
side, one
he's
side,
got-
just one side only.
He's got about 20 gloves he's trying to give away
Singapore
and
weather's too
some
hot.
sets.
We play night golf, doctor.
And he's bought a fan, a portable
Oh, really?
fan.
Yes,
so
for
he's
my
got
buggy.
it all
This is
sorted.
live now.
Oh wow!
All nice and cool.
So a neck fan and a buggy fan and everything.
Sean is scared we'll say something that we're not supposed to say.
Right.
We're live now. We're live now.
We are. We're live.
Yeah, but it's okay.
We're having a chit chat.
Go for it. Go for it.
Okay.
Okay,
Okay.
That
yeah.
was awesome.
Well,
we're good.
yeah.
We're good.
Yeah,
Doctor
thank you
has
so
to go
much.
save lives.
That's true. Actually,
thank you so
taking
much.
up so much
Thank
of your
you.
time.
Thank you.
Thank
for
you.
having
Really
us.
nice
Thank
to
you.
be with you all this morning.
It was good having you.
It's good fun.
Thank you.
And tomorrow, don't forget, tomorrow morning.
Yeah.
What's
Well,
happening?
shout
Oh,
out to
yes.
his kids.
Are y'all watching?
FD, you stand
Make
by.
sure
You
you
stay
decide
with
not
me.
to
Yeah,
Okay,
yeah, I've
off,
got
yeah?
traffic for you guys.
Thank you, doctor.
Yes.
You do.
I never have to see you,
Oh,
but
I
thank you
most
very much.
definitely want one. Thank you.
Thank you,
Thanks so
Dr.
much.
Hopefully, I don't have to see you.
Yeah,
but-
exactly.
What do you mean? Actually, yearly checkups.
Oh yeah, checkups.
Do you do yearly checkups?
I do
Dr.
yearly checkups.
I've never
I think we
gone
do.
for a
Okay.
full health.
The traffic first,
Yeah.
and then
Oh, traffic.
stand by the price. We're gonna give away that price.
Okay,
as
yeah.
well.
Yeah.
Yeah. Oh, you can do the price, Angel.
Oh, that's your bag. Okay.
All done.
That's yours.
Okay, we're going back on. Yes.
Take care.
So much. Bye-bye. So much of a good time.
Free traffic.
Alrighty, on the roads, the BKE towards the PIE, an accident after the SLE. What else do we have? SLE towards the CTE, an accident after Lentor Avenue, congestion to Woodlands Avenue 12. Reminder, Holland Road towards Minden Road, roadworks after Tyersall Avenue, avoid the right lane. That's about it for traffic. Please stay within the speed limit. Make sure you've got everyone buckled up. Be safe as you drive today.
Sorry. change it.
Good morning, Singapore. Welcome to The Big Show and The Big Show TV. All right, so we've got an awesome prize to give away.
That's
this
right.
morning.
Yeah.
Yes. And we have a question that
I've
we
got a
need. You've got
question that I'm going to be asking everyone. Okay, stand by for that.
So, yeah, the prize is a bundle worth $103 from the Powder Shampoo. Now, the Powder Shampoo is a brand new plant-based, plastic-free, and planet-first sustainable hair care brand. Their product and formula is, as I mentioned, plastic-free, 0% water in it, and you get over 100 washes with each bottle. So we've got that bundle worth $103 from the Powder Shampoo to give away if you can answer this question.
If you like a little bit of a cool feeling after
tingly
you've
one?
washed your hair, okay, go for the peppermint.
That's what I use.
Peppermint.
Yes.
You like it?
Yes, very good. Okay, so to win that awesome prize by the Powder Shampoo, this is your question. We had Dr. Paul Chiam with us. What kind of a doctor is he? That's all.
Yep, super simple. First person with the right answer on our Facebook page right now will get this prize worth $103 from the Powder Shampoo.
All
Go
right.
for it. Come on.
Here's Joey Lawrence right now. Stay forever on The Big Show, 1FM 91.3.
We're on air, will we?
Yeah, no, good.
Okay. Oh, Joey
Are you
Lawrence.
going to be very strict on the answer?
Of course.
Yes.
Yes.
Like
What's
if the
the first
person
one?
says eye doctor, no.
Okay.
No.
We have to be very
Lung
strict.
doctor also
if
no.
he says the
No, I'm sure there are more.
H word
Come on.
instead of the C word.
Oh, heart doctor?
Yeah, but I mean, what's the official term for a
Yeah.
heart doctor?
Okay, so officially we have cardiologist, interventional cardiologist.
Yes, that one.
Yes.
So Eddie Tan is our winner.
Anytime. There you go. Yes.
Dr. Paul Chiam is an interventional cardiologist at Mount Elizabeth Hospital, and if you need a cardiologist, go look for Dr. Paul Chiam.
We can't stop
Are you
him.
gonna
Why?
Are you
What
going to read
Why,
the
why,
rest?
Well, read the
And there's
rest.
just one that came out which I thought is brilliant.
I roll my eyes.
Dr. Chiam is an investment doctor.
Investment cardiologist.
Well, he's investing in
rude.
your heart health. So there you go.
There, Aloysius says Doctor Strange.
Doctor Aloysius.
Stop it.
Oh my
That's it.
goodness, you people. Behave.
Oh, that's so funny.
Eddie, can
Okay.
you WhatsApp us your...
Yes, your full name according to your IC. We don't need your IC number. Your full name according to your IC. Your mobile number is already there, and your email address. Please, we'll pass that on to our team, and they'll get in touch with you within 2 weeks.
I don't know.
Eddie,
I enjoyed
Eddie?
the session today.
Yes,
very
it was
good.
really, really good. Yeah, it was very interesting,
I've
very
got to
informative.
say-
So stop taking aspirin.
No more aspirin.
Yeah.
No, I
more
was taking it for a
CoQ10.
while.
No more CoQ10,
I never spend so much
yeah.
money. It's so expensive.
Yeah, so
I-
stop taking
I
that.
have got to say, I have been put at ease because I was hearing more and more about, hey, bro, you're reaching 10
Expiry.
years. You got to watch out for your stent. And no. And I was seriously
Worried?
starting to worry.
As
Yeah.
long as your dad has
Because
been
I-
healthy. lah.
No, because I don't want to go through that again.
Of course.
Of
So
course.
Yeah.
But is it from people that have been through it
Diet.
or just like hearsay? Hearsay,
Either
right?
way, it
Everyone's
gets
an
to you.
expert, right?
After a while, it gets to you.
no,
right?
but still, there is some truth to it. You know, in
Yeah.
order for you
It depends.
not
Yeah.
to,
Yeah.
right, not to experience anything else, then you need to
look after
to look
yourself.
after
Which
yourself
is-
and change your lifestyle.
which is why I get checks every year to make
Right?
sure
That's
that I'm
very
okay.
important. Yeah, that
It-
is very,
it's-
very
it's
important.
And
super
lifestyle as well
important.
is
Yeah.
important.
Yeah.
And once
lifestyle
again,
is
if you are looking for a doctor to have your physical checks annually, you can look for Dr. Paul Chiam. He is at Mount Elizabeth Hospital. What's that?
Showing
Yeah.
his name card. I can see it.
Quick, take a screenshot.
Do the treadmill test and blood work,
Yeah.
once a year.
Well, he's
I think it's good.
located at. Oh, he's also the National University of Singapore adjunct associate professor.
Oh, okay.
There you
Tommy
go.
Robin Hood, what
Oh,
kind
my
of
goodness.
doctor is Dr. Chiam? He's a good doctor.
There you
He
go.
is.
That is not a wrong answer.
It's not a wrong answer, but you guys are so creative.
And we only had one prize. Sorry, we couldn't give that to you.
Tommy.
Okay. And
All right.
Tommy says, if I want photography lessons, I can go to him. Because
You
remember
should.
earlier on
I
you asked me
did.
that question
He's
Oh,
about.
thanks for
Fabulous.
listening.
There you go.
Yeah.
Okay.
Okay.
We're done.
All right. Share the video.